months. So the question is, how are you going to tell how to beat your winter allergies? And to help us with that, Dr. Tania Elliott, who's an allergist. Thank you for being here, Tania. Everyone knows about spring allergies and fall allergies. Educate us about winter allergies. Why do they keep suffering more and more from this?
So, winter allergies are our indoor allergies, so they're present year-round, but they're more prevalent in the wintertime. Think about how cold our winters have been recently. We're all huddling up indoors, and so our exposure to those winter allergens spikes.
So what's the first step if you really want to get to the bottom of your winter allergies?
First step, identify your triggers. So, is it the heat? Is it the change in temperature? Or is it an allergen? So the most common indoor allergens: dust mites, molds, and pets.
All right, let's focus on these triggers. There are 3 of them apparently that you'll all be looking out for. The first has to do with turning up your heat. How does the winter heat affect our allergies?
So turning up the heat causes extreme nasal dryness and congestion. So just like we have to pay special attention to our skin and re-moisturize our skin, same thing goes for our nose and our nasal passages.
So how do we beat this? We've got some examples here, I understand.
So I think that you should keep nasal saline spray in your pocket and use it throughout the course of the day. Then I also tell my patients, take a pot of hot water, bring it up to a boil, add some fresh ginger, and then breathe in that humidified air. Add the moisture back to your nose. And then the fresh ginger gives the extra kick. It opens up your nasal passages as well as your lungs.
You know, in my house growing up, my father would do this. Except he wouldn't boil the water on a stove. He'd actually put it on a radiator. You know those, whatever heat sources you have, register in your house, put a metal or ceramic bowl on there. He'd actually just heat the water. And it would not only keep the room moist, but he'd put his head over it like this and take advantage of the ginger as well.
Absolutely, it really helps.
So there was wisdom in that.
There was wisdom.
All right. The next winter allergy trigger are pets, which we all love so dearly.
Yes.
What's the problem with pets in the winter?
So, again, it's all about exposure, being in close quarters with your pets. They're staying indoors more, you're staying indoors more. And cat allergen is very potent, and it stays suspended in the air, even if you remove the cat from the home, for up to 4 months.
Oh, gosh, we're cooked. All right, so we can't get rid of our pets in the winter, obviously, so I put a call to my friend, veterinarian Marty Becker, to see how we can best decrease pet dander.
Hi, I'm Dr. Marty Becker, America's veterinarian, to give you 3 quick tips on preventing pet allergies this winter. Number 1, you want to bathe your pet weekly. This not only flushes the allergy triggers off of them to protect them, but protects you as well. Number 2, use a grooming wipe or just a damp towel and wipe your pet down each day. And number 3, if you have allergies or asthma or anybody in your family, make the bedroom a pet-free zone.
If you still feel symptoms, you can try over-the-counter antihistamine. Easy to find, easy to take advantage of. So why do you like antihistamines, Dr. Elliott?
So I should say not necessarily easy to find, because it's really challenging to navigate the over-the-counter allergy aisle. It's a very scary place. So you want to look for something that's a non-sedating antihistamine. It's great because it works quickly and it prevents the release of chemicals that cause sneezing, itching, and congestion. So if you're going to go into a home where you know that there's a pet and it's a trigger for you, you want to take the antihistamine 30 minutes before you go to prevent those allergy symptoms.
A wealth of knowledge. It's wonderful. All right. The final winter allergy trigger is dust. So what are the symptoms you typically would get from dust, but not from the other ones?
So my patients will come in and wake up with extreme morning congestion, throat clearing, maybe some snorting, and some post-nasal drip.
Snorting again.
Yeah.
Right. So what do you do about it?
So what do you do? So you want to keep the relative humidity at less than 50%. So you can pick up a humidity gauge at the hardware store to evaluate for that. And then you want to get protective covers for your bedding. You want to wash your sheets once a week on very high heat to kill off the dust mites. And then you want to try to remove the carpeting if possible, curtains, drapes, and upholstered furniture.
And if you don't want to do all that, or you can't do that, or it doesn't work with doing all that, what about decongestions?
Decongestions can help in the short term. Remember, if you have high blood pressure, you need to be careful with these, but a short course of decongestion to dry up all that mucus is helpful.
All right, let me give everyone a bonus tip to beat winter allergies. If your Christmas tree is still up, take it down. It's been up there long enough, you already had the parties. Live Christmas trees can harbor chemicals and mold, which can trigger allergic reactions. You'll never figure it out until you take a tree out of the house. You can find the complete guide to beat winter allergies at DrOz.com. I'll be right back.